Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Colesevelem. Colesevelem is a bile acid sequestrant agent. Colesevelem is a bile acid sequestrant agent. So actually, in type 2 diabetes mellitus, the bile acid metabolism may be abnormal. If bile acid metabolism is abnormal, then we can use this colesevelem. So this colesevelem is actually a bile acid binding resin. It binds to the bile acid and it is approved for treatment of diabetes mellitus. The common side effect of this colesevelem is it can cause gastrointestinal side effects most commonly. So, what are the gastrointestinal side effects? It can cause other side effects like it can result in constipation, abdominal pain, and nausea can occur. Then it can also increase the plasma triglyceride levels. Because it increases the plasma triglyceride levels, then this colesevelem is actually used cautiously in patients with hypertriglyceridemia. In patients with hypertriglyceridemia, it is used with caution.
thank you and thank you for watching.